I know we usually start with an update on the numbers, but I'm curious to know what sort of feedback you've been hearing this week from your experts after the big announcement back on Tuesday from Governor Abbott about lifting the restrictions across the state of Texas.
Well, when I talk to the medical experts, especially the physicians and the clinical people, we respect Governor Abbott. He has a lot that he has to deal with. He's just dealt with the winter storms. So we totally respect him, but we respectfully disagree with his decision to end the mask mandate. And I'll tell you why for a couple of reasons. One, it really puts retailers and people in a very precarious position because by him removing it, even if they put a sign up, we want you to wear a mask, some people may say, hey, I don't really have to. And we don't want to have confrontations and people disagreeing. Secondly, the virus is still here. The virus has not gone away. In fact, the variants are here too. So getting people to wear masks now is probably one of the most important times as we move towards herd immunity.
Are you surprised how much of a national discussion has been prompted by what the governor announced on Tuesday?
I'm really not, because I think if you listen to the CDC, if you listen to all the people that are working very hard to distribute the vaccines, they want to get them in people's arms as quickly as possible. But with that, they want to tamp down this horrible virus. I can see why at the national stage, it drew a lot of attention.
When it comes to the key numbers, including COVID-19 cases, do we remain on the decline this week?
Yes, we do, and that's a positive. But I must say, with this mask mandate going in effect next Wednesday, coupled with spring break being upon us, I really think it's going to be 2 to 3 weeks before we see what impact it's going to be. But as of now, Chris, our numbers are about 1,270 COVID patients in our hospitals and trauma service area E, which is really about 30% of where it was 5-6 weeks ago.
That hospitalization number we've been watching, I know earlier this week it had fallen below 9%. Are we still right around that number?
Yes, we're right around 9% or a little bit less. And in our ICU units, COVID represents about 22% of all the ICU patients. About 6 weeks ago, that was about 51%. So we're clearly moving in the right direction. But as we know, this can spike as evidenced by January after the holidays.
We understand that the Johnson & Johnson vaccine will be given here in North Texas by the end of this week. Are there any other vaccines, now that we have 3, that could be coming down the pipeline to increase the variety even more?
There is one, I think it's still being looked at. It has not received emergency approval. So AstraZeneca possibly would be the next one that's going to be done. I know they actually conducted some clinical trials here in the DFW area earlier this year. But I think, that's probably at least a month or 6 or 8 weeks away if it receives approval.
And we also heard from the Biden administration this week, they're actually speeding up their timeline when everyone could have access to the vaccine. And I know your experts must see that as an encouraging sign as well.
Absolutely. And I think the other thing, I was glad to see that Merck agreed to help Johnson & Johnson produce this. I think that shows the type of what I call spirit of America, where we know this is a pandemic and we're going to all work together to help our fellow man.